Alright, Chapter 5, Modern Methods of the Quit Smoking. So for the danger of the smoke that were made public to many of the company to perform for the objective of the producing products that would help the people to quit with the smoking successfully. Some of the products discussed below with the round with the longer of the others, but just because of the longer history, that does not necessarily mean that it isn't right for you, but they always able to be able to discover the various smoking cessation products is able to healthcare provider with the pharmacist so you can choose the right product that will give you the best possible chance for the quit smoking successfully. Nicotine gum, if you want to miss the oral aspect of the smoking of the getting of the nicotine, but might be a good replacement tool for the use of the when you have the craving, chew of the gum and the chocolate into the corner of your mouth between the tongue of the gum line, where the nicotine is absorbed through the skin and helps you go into the control of your craving. Nicotine patches are also very good method of nicotine replacement. Simply apply with the patch to your skin, delivered steady slow with the release of the nicotine into the bloodstream, help to curb your craving. The many variety of the strength with available with a good idea to speak for the pharmacist, healthcare professional aside with the way one to you with the end of the wake up with the night crave with a cigarette. Using 16 to 24-hour patches available as they come into the continue with your sleep. The nicotine inhaler. Some exporters report the missing action of the smoke with the nicotine inhaler looks like a cigarette that they have with the perform of the hand over the mouth action of smoke with it going into the nicotine delivered into your system. However, critics of methods suggest that they are simply replacing one addiction with the another. Nicotine microtabs. Some people report the unpleasant taste in their mouth with the nicotine gum that apply with the perhaps microtabs a solution for looking for the also the play with the microtab on the surface underneath your tongue and allow it to dissolve the nicotine gum. The nicotine is delivered through your skin. Nicotine launches can be soaked up within 30 minutes. The nicotine delivery is through the skin and the digestive system. The lozenges come in a variety of flavor. The unpleasant taste is also masked by the flavoring, such as the mint orange. The method of the relief of the nicotine more slowly than other methods, but provides longer-lasting freedom from cravings. Nasal and oral nicotine sprays. Nasal and oral nicotine spray, but none other than method of the peel to you for the spray might be a good option as well as we all do with the spray with it in your nose, like a saline or a hay fever spray, but at the back of your throat like a sore throat spray. Relief of the nicotine craving is reported to be closed for the immediately. Biopropene. Medication that does not contain the nicotine, but the works for the change of the way of the brain with the body react with the effect of the nicotine based with the effect of the part of the brain but derived with the pressure from smoke. But typically you can make the medication coupled with the weeks after the choice from the quit date, but then continue to take about 3 months. During this time, the pleasure receptor for the brain will derive no pleasure from the smoking. They will manage you for the cravings and talk to your doctor over the options sound appealing to you. Varenicillin. Like Propatin, you start with the varenicillin up to 2 weeks before achieving the quit date. Continue with the taking with about 3 months during the time the brain will react differently with the chemical obtained with the cigarette smoke. With many people that report with the quitting soon with the quit date because they thought cigarettes tasted differently and made them feel nauseous when they put them off. The smoke would entirely talk to your doctor if this option sounds appealing to you. Chapter 6, Therapeutic Techniques.